Good afternoon, Madam Chair and members of the subcommittee. Thank you for the opportunity to testify on the President's fiscal year 2025 budget request for the Indian Health Service. I also want to first acknowledge and thank you for your work over the years to grow the Indian Health Service budget and prioritize health for Indian country. We are especially grateful for the work in maintaining IHS advance appropriations for fiscal year 2024. This is an historic achievement that has significantly changed delivery of health care for Indian country. I am also happy to report that because of the 2024 advance appropriations, IHS has made 100% of payments to eligible tribes through their contracts and compacts in the first 2 weeks of the fiscal year. I also appreciate the opportunity to share with you steps that I have taken as IHS Director to improve transparency, accountability, and oversight of the agency. As we seek additional funding and new funding authorities, it is critical that the Indian Health Service improve internal operations to ensure safe, high-quality health care, protect and support its relationships with tribes and tribal organizations. To ensure that I fully understand the challenges and accomplishments throughout Indian country, I value the time to visit with tribal leaders across the country to gain their input and perspective. In support of building a high-performing organization, I have implemented the first agency work plan in January of 2023 that achieved 3 major accomplishments, including a total system safety strategy, IHS patient safety policy, and improvements to purchase and referred care program, such as establishing updated medical priority levels, establishing a financial monitoring tool, and staff training to obligate PRC dollars in a timely manner. I know this subcommittee held a legislative hearing on the Purchase and Referred Care and Improvement Act for 2024. I am committed to the work with the subcommittee and drafters of that legislative to improve and streamline the PRC program. Building on the work plan, our 2024 work plan outlines steps IHS is taking to address priorities as well as mitigate risk. The agency work plan addresses a wide range of issues, including patient safety, human capital, operations, finance, and compliance. The work builds on our efforts to meet the GAO high-risk list and removal of the high-risk list for the Indian Health Service. With Congress's support, the IHS budget has grown by 69% in the last decade. We know that this type of growth is challenging to accomplish in this constrained discretional funding environment. Over the years, the work with our tribal and urban partners underscores that our shared goal to improve health outcomes for all American Indians and Alaska Natives. It is with this shared goal in mind that administration approached the 2025 budget request for Indian Health Service. We know that despite our shared goals and shared efforts, IHS is still underfunded, which I believe that Chair Hageman and Ranking Member have mentioned before. This underfunding of the Indian Health Service system directly contributes to the stark health disparities in tribal communities. For example, the life expectancy of American Indians and Alaska Natives born today have a 9.9 years fewer than all American race. Longstanding health disparities were also compounded by the pandemic, with American Indians and Alaska Natives experiencing disproportionate rates of COVID-19 infections, hospitalizations, and death. That is why the budget proposes to build on the enactment of advance appropriations by funding the IHS as discretionary in 2025, and then beginning in 2026, the budget would make funding for IHS mandatory. As we work towards securing stable, predictable, adequate funding to meet the needs of Indian country, we are committed to working closely with our stakeholders. Thank you for the opportunity to speak with you today, and I'm happy to answer any questions.